Good evening. My name is Audrey Frank. I'm an RN to BSN student. Today I'll be talking about a very important subject. Is there a gap between nursing education and practice? Throughout my presentation, I will be talking about nursing as a career, nursing education, nursing practice, the role of the nursing teacher, and also the role of the student. Nursing as a career. We often hear that nursing is the most rewarding career. Ever since I was a little girl, I always wanted to be a nurse. And that dream came true about a year ago when I graduated from Miami-Dade College. Nursing connects you to patients by applying not only the theories that you learn in the textbook, but also clinical experience that you acquire during clinical practice. However, more needs to be done to bridge the gap that exists between nursing education and nursing practice. Nursing education. There is more than one education pathway leading to eligibility to take the NCLEX. One can either go through undergraduate diploma in nursing. It was once the most common one. In order to have the RN license, it was available to hospital-based school of nursing. Or now we have the associate degree in nursing, which is the ADN, which is usually offered in the 2 years degree community college, and also hospital-based school of nursing that prepare individuals for defined technical scope of practice. We also have the Bachelor of Science in Nursing, which is a BSN program. It's a 4-year degree offered at colleges and universities. It prepares graduates to engage in the full scope of professional nursing practice across all healthcare settings. Once you have your RN, license, if you want to go on, you can, have your MSN, your master's degree in nursing. Those programs offer a number of tracks designed to prepare advanced practice nurses, nurse administrator, or nurse educator. You can also have the Doctor of Philosophy, which is a PhD program. It's a research-based, it's focused, it's research-focused, whose graduates typically teach and conduct researches. The last but not least, you can have your DNP, which is Doctor of Nursing Practice. These programs focus on clinical practice or leadership role. Myself, I did, the 2 years program. I got my license, was able to get a job, and now I'm working toward my BSN. Nursing practice. The practice of nursing requires specialized knowledge, skill, and also independent decision making. A lot of time you'll be placing in situation where you have to have, where you have to act very fast. For example, an ER nurse, when you have somebody coming who is bleeding profusely, you need to know what to do. Or somebody who's coming unable to breathe, you need to act very fast and use your critical thinking. Nursing careers take widely divergent paths. Practice focus vary by setting, by type of clients, by different disease, therapeutic approach, or level of rehabilitation. Myself, I work as a hospice nurse for Vitas. The way I serve my patient is different from the way somebody who works at the hospital in a med-surg floor will approach their patient. I'm more in the palliative care, whereas, a nurse who works in the med-surg floor, it's more in the curative curated, setting. More of our nurses are mobile and sophisticated and work in a society that is changing and asymmetrical for consumers. New medications are coming, new discoveries are being done. So as nurses, we need to be very proactive and, and learn. It's a constant learning. We're always learning about something new, different method of treatments and so forth. The result is that the risk of harm is inherent in the provision of nursing care. Now we'll be talking about the role of the nursing teacher. The complexity of today's nursing practitioners call for nurse educators to facilitate the learning in clinical areas. The nurse teacher have to fully understand the quality of the teaching method to accommodate an environment favorable for learning and apply in the learning clinical setting. The nurse teacher must not only ensure that theoretical input is well integrated so that it is comprehensible to the students. They need to be demonstrated how this knowledge be integrated and applied to practice. Also, the teachers need to develop strategies to support student learning. Teachers also need to be involved in keeping track of today's ever-changing technology. Yes, we need to know about, how the heart is, how the heart is made, how the heart is, functions. But it's even more important to know how to listen, for the heartbeats, when there's something going on, an abnormal sounds. So not only student needs to know the content, but also teachers need to facilitate for students to practice whatever they learn in the textbook or in the classroom. The role of the student. We often think that the teacher has, all the responsibilities. Like, okay, they need, to make us practice more. We need to have probably more clinical hours. However, as students, we need to take over of our learning situation. Students have reported using reflection as a method to bridge a gap between theory and practice. But students also should apply themselves not only to textbook, but most importantly to practice. That's when we go to clinical areas in the hospital, we need to be more proactive, ask more questions, try to learn more. Nursing student perception of acquired reflective skill and theoretical knowledge has a substantial impact on their perception of coherence between the theoretical and practical component of their initial nursing education. The acquired reflective skills of students are connected to both acquired practical skills and theoretical knowledge and act as a mediator between the students' acquired practical skills and theoretical knowledge. So we need to also try to join that bridge that is, between practice and nursing in the textbook. The theory-practice gap, it will seem, is a multifaceted problem. So not only the teachers, need to help us out more, but also we students have our responsibility too. Nursing students experience learning from a clinical as well as theoretical perspective, and it was from this viewpoint that the problem of the theory-practice gap was reviewed. The nurse teacher has a potential to facilitate learning in the clinical area as well as in the classroom. Acting solely as a supervisor to student, while viewed as a useful learning strategy for students, was generally not seen as an appropriate role in nursing, in that it tended to concentrate on tasks as opposed to nursing issues. So my thing will be, yes, the teachers need to, be good, supervisors, while in clinical area, but also as they need to focus more, instead of having 10 quizzes, several tests, and test our knowledge, in the textbook. We should be spending more time in the clinical area, so that when we graduate and we get a job, we're not lost, and we are able to function fully and able to apply whatever we learn in nursing school. That is the end of my presentation. Hope anybody will watch it learn something.